Good afternoon, everyone. I'm going to call to order this meeting of the Public Health, Environment, Civil Rights, and Engagement Committee for Monday, October 15th, 2018. My name is Philippe Cunningham, and I am the chair of this committee. And if I may, just for a moment, I want to wish my parents a happy anniversary today. With me at the dais today are council members Cordon, Johnson, and Jenkins. Let the record reflect that we have a quorum. I do believe we will be joined by Councilmember Cano shortly. So on today's consent agenda, we have 5 items. The first is a domestic violence awareness honorary Domestic Violence Month honorary resolution, which is the passing of it to recognize October 2018 as Domestic Violence Awareness Month, which is why I'm wearing my purple flag there. Number 2, we have setting a public hearing for October 22nd, 2018 to consider an ordinance relating to planning and development, small and underutilized business enterprise program, updating procedures for administration and amending the sunset date of that program. Number 3 is a request for proposals for community solar gardens. Number 4 is community solar garden agreements. And number 5 is gun violence prevention in Minneapolis. So this was moved over from the public safety emergency management meeting. We had a robust conversation for those who aren't on that committee or folks at home. We had a robust conversation. It was September 27th. We discussed all of the various work that's happening throughout the city, the efforts with gun violence prevention. I highly recommend for folks to go to the City of Minneapolis's LIMS site, that's LIMS, the website, and type in gun violence prevention to be able to watch the video. There you'll be able to see more comprehensively not only the work that's happening, but the impact that's happening as a result of this amazing work. So like I said, this was referred because of the public health approach to public safety. And so I'm very grateful to Councilmember Cano for her collaboration and leadership on this. So the information that was provided from that presentation, first that came from a spike in gun violence that we saw a few months ago now. And so this presentation really has been the catalyst for the creation. Right now we're in the process of creating an Office of Violence Prevention in the Health Department. And so that's going to be our next steps with these efforts, so that we're actually supporting these evidence-based strategies, that we are seeing the data that is actually moving the dial and working. So just wanted to name that's what that's about. We're going to be picking this work up and taking it from here in collaboration with the Public Safety and Emergency Management Committee as well. And so on that note, do any committee members have any questions or wish to pull any items from the consent agenda? All right, seeing none, I move approval of the consent agenda. All those in favor of the motion, please signify by saying aye. Aye. Those opposed say no. The ayes have it, and those items are approved. So today for our discussion, we have 3 discussion items that I'm very much so looking forward to. The first is going to be a presentation on the Public Health Advisory Committee 2017 Annual Report. Margaret Schuster, Senior Public Health Specialist for the Health Department, will be giving the presentation. Oh, did you want to kick us off, or did you want, okay. So we actually have folks here from, I believe, the Public Health Advisory Committee, so I'll actually pass it on over to you folks. If you could say your name for the record, that would be greatly appreciated.
Chair Cunningham and committee members, my name is Sarah Jane Caveney. I co-chair the Public Health Advisory Committee, and I'm the representative of Ward 9, Alondra Cano.
Hi. And I'm Margaret Reinhardt, Ward 10 representative on the PHAC. We are here to present the 2017 Public Health Advisory Committee Annual Report. The Public Health Advisory Committee is charged with these responsibilities: to advise the City Council on policy matters which affect the health of Minneapolis residents, to review proposed priorities of the Health Department, provide input and make recommendations, and to consider complaints, concerns, and views expressed by residents of Minneapolis regarding public health. These are a few PHAC members. Tycia Fletcher on the left is the mayor's representative. She is passionate about lead paint in homes and interventions to prevent lead poisoning in children. Top right is Sarah Jane Caveney, Ward 9 rep, and current co-chair with me. And at-large member Joseph DeSenclos recently appeared on Hmong Radio to talk about serving on an advisory board. The PHAC committee is made up of volunteers who commit their time, energy, and expertise to public health issues and concerns in Minneapolis. 20 members sit on the committee and represent each ward in Minneapolis, the mayor's office, the University of Minnesota School of Public Health, and Minneapolis Public School, and Hennepin County Public Health. 3 members at large are also appointed to the committee. Members must live or work in the city of Minneapolis. Ward appointees must live or work in the ward to which they apply. Each member is appointed to a 2-year term and may serve up to 3 consecutive terms. It is expected that all parties responsible for recruitment, recommendation, and approval of members make every effort to ensure the committee composition reflects the diverse interests and perspectives of the Minneapolis community. And next we have a list of the current members. You see 2 vacancies listed. These are posted on the city's board and commission's website page. Interested applicants must live or work in the ward listed. Do this. Let's go.
In 2017, the PHAC examined several public health issues: housing, recycled tire mulch, healthy homes, access to tobacco and flavored tobacco, green zones in Minneapolis, and congregative sex venues. Additionally, the PHAC provided feedback to the Minnesota Department of Health on the statewide health assessment. From 2014 to 2017, we studied housing instability and concentrated poverty, homelessness, and the loss of affordable housing. And this became a priority when looking at other public health initiatives and how they impact health of all Minneapolis. After years of the study, our committee made a formal proposal to the Housing Policy and Development Committee, newly created, for a Minneapolis Advisory Committee on Housing to address the housing needs of Minneapolis residents. PHAC also began learning about lead hazard control in Minneapolis, and this learning is continuing now. PHAC members also named health disparities, health equity as a high priority. Minnesota continues to be plagued by some of the worst health disparities in the country. Our committee members are fully aware that this committee alone cannot adequately address and change these disparities. However, we keep the focus on this area by continually asking our presenters to address these questions specifically when they come to our committee meetings. The third priority focuses on mental health, especially community stress, trauma, and violence. The committee recently heard a presentation from the program manager for RECAST. Learning in this area, we expect to continue as well. Several members helped review nominations for local public health hero awards. 3 recipients are pictured here. PHAC members also helped review applications for committee vacancies and participated in interviews when asked to do so. They conducted orientation sessions for new members and recognized committee members' contribution at the end of their terms.
We will return in 2019 to present the PHAC's accomplishments from 2018, but here is a preview of some of our actions taken thus far this year.
Yeah.
Sure. Okay.
Well, that really concludes our presentation today. But we want to remind everyone that the PHAC meetings are open to the public. and are held on the fourth Tuesday of each month. Our meetings run from 6 to 8 p.m., and our meeting records are also posted online, and we're happy to stand for questions. Thank you.
Thank you so much for that presentation. I have Council Vice President Jenkins.
Thank you, Chair Cunningham, and thank you, Sarah Jane and Margaret, for that presentation and for the work that you guys are doing on behalf of the communities and the city. We really, really appreciate it. I was curious, you said you guys thought about or analyzed or maybe weighed in on congregate sex venues, and I'm wondering what kinds of recommendations came out of that.
Thank you for the question, Chair Cunningham and Councilmember Jenkins. We had, so the way that our committee works is individuals from the community can bring concerns to us to look at, to advise council, and then similarly, council can bring issues for us to take a deeper dive into. So this was a concerned community member who was looking at some of the closing of congregate sex venues and wanting us to be aware of the impact when places are closed or when there's different licensing or different things in question and how that impacts things. And I think there was a bigger concern about just community relationships around this. So it wasn't an action that we moved forward on as far as making any recommendations, but more just awareness within our committee.
So just as a follow-up, the awareness is that there are limited places where these activities can happen?
There are limited places where these activities can happen and are sanctioned. There are also some questions around licensing and health. I remember that there were some parts, and forgive me, I'm not, this happened a while ago, so this is from my memory, that oftentimes there's other public health issues about the venues themselves. So I remember that there was one question around a heating system that was used in a facility. And then I think the bigger question is when we don't have places for people to congregate, then we'll find other places that won't be as healthy. I think another big issue that came forward was that in places that are known and that are working towards licensure or working towards, really focusing on health, have relationships with community partnerships such as the Red Door or the county or other agencies so that there can be some public health practices that are brought in. And so when it's not in a place where people have access to healthy decisions, then other places will come forward that aren't as healthy.
Okay, no, thank you very much for that response. I just know that there's some community concerns about the lack of those spaces and even more particularly, making sure that those places are promoting healthy sexuality and providing resources for people to be able to be healthy in those pursuits. So thank you.
Yes, thank you.
Thank you. Seeing no other questions, I actually will jump in here. I see that is it possible to go back to the slide with your priorities? Yeah. So when we look at priority 3 with mental health, community stress, trauma, and violence, I'm curious, where does the PHAC fit into the gun violence prevention work that's happening and the other violence prevention work that's happening in the city?
It's a great question. Thank you for the question, Chair Cunningham and other committee members. So when we develop our priorities, we do kind of like a deep dig into like broad, how many people are interested in these different things, where are they coming forward from? We have over the years had the Youth Advisory Board as well as folks from the hospital or other agencies that have come in to make presentations. So that's one way that that's come forward from community members. And then mental health in connection to chemical health, Housing trauma continues to be something that keeps coming forward, as well as health disparities and equity. And I see just a huge link between that, the mental health and then the disparities. So that's another way where the independent people on the committee are naming that as their priority for what they'd like to see. Some things have been more broad, like sleep hygiene and these sorts of things and how that contributes. And then some specifically on access to mental health services. So Recast came to our last meeting, and they're really talking about broadly, how do we define mental health and how do we make sure that community-specific mental health services are being supported in addition to more of the structural mental health.
Great, thank you for that. And I guess I'll have one last question. In terms of the comp plan, has there been conversations amongst the PHAC about the comp plan and where public health fits in? Because public health is everything, basically. And so, as I was going through it and looking at it through the public health lens, I'm just curious to hear from the folks if there's anything that pops up or any feedback or guidance on that.
I can address that, Council Chair Cunningham and other members of the committee. We did have a presentation from CPED about the Comprehensive Plan 2040, and there were specific areas in there related to public health, and each of us was encouraged ourselves to go and go to the plan and make comments on the link. But it was an eye-opening just to hear the presentation, and really appreciated the broad scope of the comprehensive plan. A lot of work that has gone into that. So I think primarily it was on an individual basis that we were encouraged to go and make comments. Mm-hmm.
Great, thank you so much for that. Any other questions from my colleagues? All right, seeing none, thank you so much for your time, and as community taking the time to be here. Thank you for your time and your service, and thank you for your presentation today. Seeing no questions, I move to receive and file the presentation on the Public Health Advisory Committee 2017 Annual Report. All those in favor, please signify by saying aye. Aye. Those opposed say no. The ayes have it, and that item is received and filed. Thank you so much.
Thank you for your attention.
Of course. Next up, we have our second discussion item is a presentation on the Staple Food Ordinance. We have Kristen Klingler, Senior Public Health Specialist for the Health Department, who will be giving today's presentation, and I will be passing it on over to you. Thank you.
Thank you. Good afternoon, Mr. Chair and members of the committee. My name is Kristen Klingler. I'm the Assistant Manager for the Healthy Living Initiative within the Health Department, and I'm joined today by Dr. Melissa Laska, Professor of Epidemiology and Community Health with the University of Minnesota School of Public Health. And today we're here to talk about the Minneapolis Code of Ordinances, Title 10, Chapter 203, Grocery Stores, which is informally known as the Minneapolis Staple Foods Ordinance. So we'll talk about what the ordinance is and why we have it, and then discuss how it's working and some opportunities for improving it. The Staple Foods Ordinance was originally adopted back in 2008 and significantly revised in 2014. It sets minimum stocking standards for all licensed grocery stores in Minneapolis. So with few exceptions, all supermarkets, co-ops, corner stores, gas stations, dollar stores, pharmacies, and other general retailers that sell food have to stock a certain amount and variety of nutritious foods as a condition of their business license. The ordinance doesn't restrict the sale of any item, but rather it's intended to ensure that no matter where someone shops for groceries, they're able to find what they need to prepare a healthy meal. This is especially important in neighborhoods where residents lack easy access to a full-service grocery store and have to rely on other non-traditional food outlets to meet their needs. If residents lack access to healthy foods, they often struggle to maintain good health and to prevent chronic diseases such as diabetes, heart disease, and high blood pressure. And in Minneapolis, rates of chronic disease are disproportionately higher among low-income people and communities of color, many of whom also experience inequitable access to healthy food options. The city and its community partners have invested significant resources in trying to improve the availability of healthy foods across the city. And so the Staple Foods Ordinance is one piece of that larger coordinated approach. As I mentioned, the City Council, some of you on this committee, unanimously adopted significant revisions to the ordinance back in 2014, increasing the number of food categories and requiring higher quantities and more varieties. The current requirements that stores have to meet are available for reference in your briefing packet, and the handout that has the current requirements looks like this for reference. Since these revisions took effect in 2014, the Health Department has worked to educate store owners, monitor their compliance, and provide support to help them comply. I'd now like to show a brief video so that you can hear directly from some small business owners and residents about how the Staple Foods Ordinance contributes to the health of their community. Please bear with me as I try to pull this up.
Yesterday I came and got a fresh lettuce for a salad. So, yep, I always come here and get my fruits and vegetables.
I think it's really helpful to have healthy food really close to me.
We can find everything we need right here.
I just love this store. It's part of my neighborhood, and I like that.
In many communities in
Play again.
Got a fresh lettuce, for a salad. So, yep, I always come here and get my fruits and vegetables.
I think it's really helpful to have healthy food really close to me.
We can find everything we need right here.
I just love this store. It's part of my neighborhood, and I like that.
In many communities in Minneapolis, access isn't the same for healthy foods as in other communities. So we developed the Staple Foods Ordinance and adopted it as a way to increase access to healthy staple foods.
When we first heard about the ordinance, there was like, oh, how are we gonna do it? But when we tried it, I like it, attracted more customers to my store, and it helping my existing customers.
Staple Food Ordinance enhanced my business. I started keeping healthy 100% juices and cereal. Apart from lentils, beans, and peas we already have, I sell a lot of vegetables and yogurt, milk, and 100% juices.
We have food from Mexico, we have food from Guatemala, from Salvador, from Ecuador, and I really think us and other businesses, if we keep up with that and we have like a big variety, I think eventually it's gonna be better for our business and it's gonna be better for the community.
We sell a lot of peaches and grapes. I have a sink there. There some people buy the bag. Mike, can we please just wash it? And I see them outside just to snack it, waiting for the bus.
We sell fresh vegetables and carry all kind of dairy products. For the small retailers like me, it is a lot of encouragement and bonding between the small businesses and city.
Some of the store owners I work with are a little intimidated perhaps by what's on the list, and they're not sure if it's going to sell. But after working with the store owners on maybe placement of where it goes in the store, they're really finding that especially the fresh fruits and vegetables are selling really well.
Our consumers will always come and they will appreciate all the different items that we have.
Well, customers like the idea that's easy access to healthy food. It was big shifting that you have to have those food. But over the time, I found out that it's just like any other products.
Yesterday,
Okay, so at the same time that the city was implementing the revised ordinance, a team of researchers led by Dr. Laska was rigorously evaluating the outcomes. I'd now like to invite Dr. Laska to share some of the key findings from that research.
Thank you. So I'm currently leading this research effort at the university, funded by NIH and CDC. We're examining the impact of the Staple Foods Ordinance revisions in Minneapolis compared to St. Paul, where there is no such policy. So St. Paul is our control community. And we've recently completed our primary outcome analyses looking at changes in healthfulness of store environments and also changes in nutritional quality of foods purchased as a result of the ordinance revisions. For our study, we randomly selected 180 stores across the two cities. What's worth noting is that we specifically excluded stores from our study that are supermarkets or other large stores that we thought would inherently just have these foods already and wouldn't necessarily be challenged by the ordinance. So we're really looking at what we might consider challenged or at-risk stores here. We ended up with a sample of corner stores and convenience stores, gas stations, pharmacies, and dollar stores. In our data collection, we had a number of different parts. We did extremely in-depth store audits at each of our data collection time points. We did interviews with managers and owners. We interviewed several thousand customers over the course of several years. We also had a series of home visits with frequent shoppers in these stores where we're hoping to be able to get a better sense of what the home environment looks like for people who are often in these stores and buying their food there. Our study timeline is as followed here. The City Council did approve revisions to the ordinance in 2014, and then the revisions became effective in 2015 in April. They did not immediately begin enforcement, so it wasn't until 2016 that the health inspectors started looking for Staple Foods Ordinance foods on their inspections. We had 4 time points that aligned with these points. At baseline for time 1, time 2 immediately after implementation, time 3 at initiation of those health inspections, and then at time 4, which happened summer and fall of 2017. I think it's important when we consider the context of these results to consider who's shopping at these stores and what they're buying. We did a series of descriptive results, descriptive analyses looking at our baseline data, and these results come from our baseline data in 2014. What's clear is that these retailers serve a really diverse range of customers across SES, across race and ethnicity. For the customers that we interviewed outside of stores, 1 in every 3 customers reported shopping at the store daily, and 3 out of every 4 shop there at least weekly. So we're talking about customers that really have a relationship with their store, and they're there quite often. On average, across the sample at baseline, people purchased 2 items, and they spent $2.68, though that varied widely. We had some people buying a lot more than that. And they weren't particularly buying healthy foods. You can see here some of the nutritional composition, 40% of calories from added sugar, refined grains, sodium was high, lots of sugar-sweetened beverages, etc. In terms of our longitudinal findings, our findings over time with regard to store offerings, what we're seeing essentially is that Minneapolis stores that we're looking at are stocking healthier foods since the revisions to the ordinance passed, but so are stores in St. Paul. And I'll show you some results that explain that. Here you see a graph looking at the percent of stores that met at least 8 out of 10 Staple Foods Ordinance standards. So there's 10 different criteria that stores need to meet. In Minneapolis, 24.4% of stores stocked 8 out of 10, at least 8 out of 10 standards at baseline, and that went up to 50.5 in 2017. In St. Paul, the absolute number of stores that are stocking that quantity of food is lower, but the change over time doesn't differ significantly from Minneapolis. We looked at this in a variety of different ways, and I'll just show you a few of them. This is an indice looking at if a store stocked any food in each of the 10 staple food categories. So they didn't necessarily meet the minimum quantities or the minimum varieties, but they had something in the store that fell in that category. Here we see much more dramatic increases in Minneapolis. This was the only index that we looked at that was significantly different over time between Minneapolis and St. Paul. We saw greater changes in Minneapolis versus St. Paul. And then finally, our main outcome that we declared to NIH would be our primary outcome that we'd be looking at in stores, a composite score, healthy food supply score that's been used in the scientific literature previously in other studies. Again, we're seeing changes over time, but similar changes in Minneapolis and St. Paul. It's worth noting that enforcement or compliance is a challenge. In 2017, we saw only 10% of the Minneapolis stores in our sample fully compliant with the ordinance, which is much lower than we expected when we initially began this work. And it's not clear that we can kind of point to one or two aspects of the ordinance and say, gosh, this is what it's really all about. None of the stores are meeting this aspect of the ordinance or that aspect. There's really a lot of heterogeneity in terms of what stores are meeting what parts of the requirement. To date, our data show few significant changes in nutritional quality of customer purchases in these stores. We looked at a variety of different aspects of customer purchasing. In your briefing packet, you have a one-page handout from us summarizing some of those results. You can see a graph there looking at calories over time, looking at a healthy eating index score over time. Basically, we're seeing no consistent changes yet over time. The data are what they are, and I think we need to take them for what they're saying, but I do think it's worth noting and interpreting this in the context of the enforcement or the compliance results that I just showed you, where many stores aren't yet compliant, whether it be fully compliant or even when we looked at 80% compliance, we're only dealing with half of stores being 80% compliant at this point. And also that these changes take time. The last piece of data that I'll present to you, we did interviews with managers and owners at each time point. In our last time point in 2017, we asked some really broad and open-ended questions of managers about what do you think about the ordinance? What do you know about the ordinance? It turned out that most Minneapolis managers did know about the ordinance and they understood it. There were many of them that said explicitly that they didn't have concerns. However, one concern that was raised by a subset of managers was about having to stock food that didn't sell, and then particularly with the perishable products, it was wasted. We also asked them, what can the city do to help you with the Minneapolis Staple Foods Ordinance? Do you have suggestions you could give us? And just some of the highlights that came out of that, that came out of those open-ended questions were saying that they needed help providing, finding suppliers of healthy food, particularly suppliers at a reasonable price. The health department has done work in finding suppliers and linking those up with stores, but that's a really important need that the stores need met. Interestingly, there was a subset of store managers that said mandating more inspections and consequences for noncompliance would be important. Why aren't we, being inspected more often? And then also they suggested lowering the requirements and quantities for the types of food. So just in summary, kind of the take-home messages of the longitudinal findings is that stores in Minneapolis have begun stocking more healthy foods, so have stores in St. Paul. Full compliance with the ordinance is still very low at this point, and as of yet, we haven't seen systematic improvements in healthy customer purchasing.
All right, if I can actually jump in here, we have a question from Councilmember Johnson.
Thank you, Mr. Chair. I think very interesting information, helpful information to add into context. When you mentioned the different recommendations for how to improve this, and one of those was increasing inspections and having consequences for noncompliance, what are the consequences today? Are there fines if people just are not compliant? I mean, 10% compliance is incredibly low, especially given how long this ordinance has been around.
Thank you, Mr. Chair, Councilmember Johnson. Currently, the stores receive an inspection from the health department staff every 1 to 2 years as part of their routine health inspection. They look for staple food ordinance compliance. If a store is not compliant with the staple food requirements, then they receive a written violation as part of their overall report of what else they're missing from the Code of Ordinances. And then they usually are given a period of time 30 to 60 days often to correct any violations that they've received, including any staple food violations. And then after that time, the health inspector can come back and they can reassess compliance. And if they're still out of compliance, then they could issue a citation, which is a more formal version of the violation, as well as a monetary fine of $200. And then they can continue to do that over time, reissuing $200 fines up to, I believe, a $2,000 maximum, at which point they could start to revoke the business license. And the philosophy has been so far is that we want to make sure that we're supporting stores early and often so that we don't get to that point. But we have not issued any citations or monetary fines yet. Stores have received violations, but not that more stringent consequence.
Since the ordinance has been around almost 10 years.
Since the revisions went into effect.
Okay, so since 2004.
And enforcement started in 2014. Well, the revisions were adopted in 2014. Implementation started in 2015, and then enforcement of those revised requirements started in April of 2016. So since April of 2016
so a little more
to
than
now,
2 years, there's been no citations or anything like that. And when you say they can do follow-up, I mean, are they consistently going out after 30 to 60 days to check in? And then if so, I would think then 90%, if 10% of the stores are in compliance, then 90% of the stores are out of compliance. And if they're inspected every year, then over 2.5 years, you would think that 90% of our license holders have been found out of compliance and have had work orders to correct within 30 to 60 days and have had, because it's been 2.5 years, have had repeated follow-ups by inspectors, and they're still not in compliance.
Mr. Chair, Councilmember Johnson, I believe that due to limited capacity of our health inspectors, which is an issue that I think has been brought before the council quite a bit, they are not often able to go out and do those re-inspections, especially if it's just for the staple food ordinance requirements. Given the limited resources, they have to focus their follow-up visits on urgent, critical food safety violations. Gotcha. I don't want to speak for the food, lodging, and pools inspectors, but that's my understanding.
Gotcha. So it's a breakdown in inspections and compliance around staffing resources overall, and so therefore it's not being fully enforced.
I think it has to do a lot with the lack of resources for the health inspectors, and they would like to do more if they had more resources.
That's helpful to highlight. I appreciate it being highlighted because it would be nice to get the compliance up higher for folks. Thank you.
Yes, thank you.
I have a question from Councilmember Cordon.
So one of the, well, I really appreciate the partnership with the university and all the work that you've done with this research, and was definitely very excited about it when we were passing the ordinance. That's, I think, one of the reasons why we took some time to get some baseline data and some information and kind of roll this out. That said, I was also pretty disappointed not to see more actual healthy food purchasing in the shoppers' bags. And I'm wondering if you have any idea why we didn't see more improvements in what we saw them leaving the stores with.
We were disappointed too. I think, Councilmember Cordon, changes take time, both in terms of changing the retail food environment and getting policy implemented and getting compliance up, as well as changing people's shopping behaviors and their food choices. It's a complex thing that not many people have been able to crack in terms of coming up with solutions of how to improve purchasing behavior. I keep coming back to this as one part of a comprehensive plan that the city has. We never expected this one change to be the be-all and end-all in getting people to eat healthier, though I did expect to see healthier changes in purchasing by this point. And so I just keep coming back to the comprehensive nature of the plan. It takes time, and we have to get the compliance numbers up.
And I suppose compliance will help, and maybe there's educational efforts that we can take. I remember hearing one research project that was done when we were passing this, when we looked at some cities after the WIC standards went up, and you looked at them over time, and we actually seemed to see some decrease in diabetes and obesity in those areas that were studied. We're not actually studying anything like the health of the actual shoppers, are we?
No, and that was intentional. With the WIC changes that came about, they were also the retailer standard changes also came along with the vouchers that people can use to buy foods and education as well. So it was a much more comprehensive package being implemented at a federal level. So I think we expected to see much bigger, more dramatic changes there. There are some efforts afoot in Minneapolis to, particularly in North Minneapolis, to look at incentivization programs. How can we incentivize fruit and vegetable purchasing in particular at some of these smaller stores now that they're mandated to stock these foods? And so there's an effort in moving toward that direction, but no, specifically we're not studying changes in weight and diabetes, and I wouldn't expect there to be changes that large just due to this one policy change.
And it will probably take a while. I'll also note that in the video, I did notice lots of great shots of fresh produce, but then there were also a couple shots where you could see that there was a whole wall of familiar soda pop sugary beverage sitting there. So I'm sure there's lots of competing things in the store for people to buy. My last question is, this is one phase in some research. Are you hoping to continue with the research into the future?
We are. We have a lot more of our dive to do into the data. So right now we've just finished the primary analyses, but we're hoping to dig in and get some more explanation as to what's going on and where things are happening, if there are things happening in some places and not others. We also hope to secure additional external funding to continue for at least a couple more rounds to see if we can, if the city can get compliance up and we can follow this out for a little bit longer, will we see changes down the road?
Well, good. And I hope if we upgrade our inspections a little bit and we tweak the ordinance to refine it better, it's not going to mess up your research findings.
No, that would be perfect.
Thank you.
Thank you, Dr. Laska. Just to note, the Health Department, in addition to the store study data that Dr. Laska just described, the Health Department also has been conducting annual compliance visits, more for education and monitoring. Our team does not have the regulatory capacity to enforce, but we wanted to at least go out and get a snapshot of what was happening in all of the stores to supplement what Dr. Laska was seeing in the sample of stores that she was studying. And so there are some statistics from our 2018 compliance checks here on this slide that shows some positive incremental progress, even though overall compliance is low. So across all 242 stores that we visited this summer, we actually saw 93% were meeting 6 or more of the 10 requirements. 74% were stocking the required amount of fruits and vegetables, and 85% were stocking the required amount of whole grains. So our own data aligns with that of Dr. Laska's. I did want to highlight some of the positive steps that we are seeing among the stores. And these results are outlined in more detail in your briefing packet as part of the 2018 compliance report.
If I may ask a quick question, jump in. Well, first, I just want to say thank you for your work on this. I really appreciate rigorous academic study of policy so that we know if what we're doing is working and how to tweak it. So I think this partnership is amazing, and so I'm glad to see it. Thank you for all your work on that. I see that we're going to be talking here about cultural dietary preferences, and that's always been a question that I've had around the staple food ordinance, given that so many people of color, particularly Black folks and Asian folks, are lactose intolerant. And so just wondering how that impacts businesses that serve predominantly people of color. And so I just wanted to, I see that we have a beautiful summary on it. And so will that be something that you cover here as well?
Yes, Mr.
Okay,
Chair, we'll
great.
go into that
Thank you.
next. That's a great segue. In addition to the store study data and our own compliance visits, we actually interviewed 50 ethnic grocery store owners this summer to dive into that very issue. What are customers' cultural dietary preferences and how do they align with the current staple food requirements? In 2014, we did take into account cultural differences when we were drafting the language, but based on feedback that we've received, it does seem that there are some opportunities to better match those staple food requirements up with the consumers' cultural dietary preferences that are represented in our community. So in your briefing packet, I would like to make note that there is a table of the proposed changes side by side with the current ordinance requirements, and you may want to locate that and pull it out since I'm going to dive into some of the changes, but just due to our time constraints, I'll be moving through them very quickly. So broadly, we propose to do two things with this round of revisions. First, we would combine similar categories, reducing the overall number from 10 to 6. And second, we would reduce required quantities while expanding acceptable varieties and package sizes to address some of the cultural concerns that we've heard about. So let's take a closer look at the first category of changes, which is combining similar food categories. And specifically, we propose to condense the milk and milk alternatives and cheese categories into one single dairy and dairy alternatives category. We'd like to combine the meat, poultry, fish, and vegetable proteins category with the eggs category and make that one animal and vegetable proteins category. We would keep fruits and vegetables and 100% juice as separate categories like they currently are. Then we would combine whole grain cereal and whole grains into one whole grains category. And finally, we would combine canned beans, dried beans, peas, and lentils into one beans, peas, and lentils category.
All right, I have a question from Councilmember Johnson.
Yes.
Thank you, Mr. Chair. I just wonder about the juice aspect on there, the 100% juice. Obviously, if you eat fruit, right, you're getting vitamins, you're getting fiber, you're getting a whole range of different micronutrients. With 100% juice, my understanding is lacking the fiber. For the body, it's pretty much just a big glycemic hit. It's just a ton of sugar, and it's to the point where I've heard from friends with children that now doctors are recommending that they don't even give their children juice because it's very little difference between that and, for instance, like a soda. So what are the thoughts around keeping that in here if we're going to revise this and if we're promoting something that might have negative health consequences from a caloric standpoint and from a glycemic index standpoint?
Mr. Chair, Councilmember Johnson, that's an excellent point. Thank you for bringing it up. It's something that we've struggled with over the last few years as we've talked about healthy food access and what to require stores to stock. The current requirements, we should note, are based on the Federal Women, Infants, and Children WIC program, which does include 100% juice. And so that was our starting point, and we've made adjustments to those requirements since then. It's something that we know stores are stocking juice in general, and so we want to make sure that if they are going to stock juice, like we know they are, that at least they have 100% juice options available for customers. So we've decided to keep it in. We don't hear a lot from store owners that it's a particular area of concern or challenge for them to meet the current requirements. So we haven't proposed any recommended changes to the category now, but your point is well taken. And as a health department, as part of our Rethink Your Drink initiative, where we try to reduce sugary drink consumption, we make sure to educate people about the 100% juice may be a little bit healthier than pop or soda, but we recommend very small quantities, and more than that, we recommend drinking plain water, since that really has the best nutritional value.
Yeah. And did you get feedback from stores in terms of when they're implementing this, what is really about meeting the letter of the ordinance and what's about meeting the spirit of it? I noticed one of the pictures, I saw a ton of lemons and limes in there. I mean, I don't know about my colleagues or anybody else, like how many lemons and limes you're consuming every week, but like that to me is not a daily, part of a normal fruit intake. That's more like for something you're baking or a cocktail or what have you. So are you seeing stores that are really, it looks like from the video, some stores are really embracing this and stocking up on a lot of different things, but are others, do you get the sense that they're just trying to meet this and, not really, and find things that are inexpensive and that are easy to fulfill their requirements, but are not actually necessarily catering to their customers and are being a substantial part of a person's diet?
Mr. Chair, Councilmember Johnson, I think when we revised the ordinance for the fruits and vegetables requirement, we tried to leave it as flexible and broad as possible. So we currently require 7 varieties of fruits and vegetables, 5 of which have to be fresh, and no more than 50% can come from a single variety. So we're trying to encourage stores to stock a wide variety of fruits and vegetables, again, that meet their customers' needs, things that they know their consumers are going to buy. In some stores, the lemons and limes sell really well, and they are part of the cultural diet, so we don't want to restrict that, but we do try to help them think of other fruits and vegetables that are easy to stock, that won't spoil very quickly, so that they can have a wider variety of foods that offer more nutrition and meet their customers' nutrition needs.
Thank you. And then I guess just one last thought, and this is how we try to sometimes, take these different intersecting issues and goals. And so this is obviously an important aspect around healthy access to food. And especially, I think, an important thing to consider is affordable access to food, right? And yet we also know that certain types, for instance, of proteins come with a massive environmental impact. So we can't forget our environmental aspect of being in this committee. And so I don't really even know that I need an answer on this, but more just a thought of, if there's a way to find that balance and strike that balance of offering more access to healthy foods that are affordable, but also trying to not push stores towards potentially more environmentally costly food options, I think that would be appreciated. And I'm sure it's something you're considering, but I want to also voice support for that. So
Thank you, Mr. Chair, Councilmember Johnson. I think that's an excellent point as well. Not something that we've discussed in great detail when we talk about the type of support or education that we provide for stores, but certainly something that we can continue to consider. We have done a lot of conversation around helping stores to stock locally grown fruits and vegetables or local products, but I think this is a great additional aspect to think about in the future. So in the time I have remaining, I'd like to briefly run through some of the specific required quantities, varieties, and package size changes. And again, the goal today was just to introduce these to you. We would be more than happy to follow up individually over the next few weeks to walk through these in more detail when we have more time. The dairy and dairy alternatives category was the area of most concern for stores that we talked to, milk and cheese being things that aren't commonly consumed in some cultures. So we've made the most significant changes to this category. We're actually proposing to reduce the amount of the quantity required to 8 gallons or pounds total across any kind of dairy or dairy alternatives. And that's down from the 11 pounds that we required across both the milk and the cheese categories currently. We're also proposing to reduce the number of required varieties down to 3, which currently it's at 5 across both the milk and cheese categories. And then we also want to allow 2 other commonly consumed dairy items, kefir and yogurt, which we don't currently allow. So you'll see those as well in your table as acceptable dairy or dairy alternatives. The final thing that we want to change in this category is to allow smaller package sizes. Currently, we require milk and milk alternatives to be in half-gallon or gallon-sized containers, and that can restrict stores' ability to stock culturally appropriate options such as camel milk or almond milk, which tend to come in 1-quart containers or smaller containers that we don't currently allow. So we would like to adjust the package size requirement to be more flexible. With the animal and vegetable proteins category, as Councilmember Johnson mentioned, sources of protein are readily available and fairly inexpensive, so we are not proposing any quantity requirement for this category as long as stores are stocking 4 different varieties. And we'd like to combine fresh eggs into the protein category as an allowed but optional item that stores can stock. And if the store chooses to stock eggs, then we would propose eliminating the size and type and container count requirements to make it easy for stores to stock culturally appropriate options such as duck or quail eggs, which tend to come in different sizes that we don't currently allow. Fruits and vegetables, the only change that we're proposing to this category is to increase the number of frozen items that a store could stock from 2 up to 3. And that is to address a concern that we've heard from some store owners about having to throw away perishable products, specifically fresh produce, if they aren't able to sell it quickly enough. And so we think that allowing them to stock another frozen variety might help them reduce the amount of wasted food that they have while also maintaining nutritional standards. Again, we're not proposing any changes to the 100% juice category at this time. With the new whole grains category, we propose to maintain the same total quantity and required varieties that we currently require stores to stock, but allowing any size of container except the single servings of packages. This way we'll give stores enough flexibility to choose whatever whole grain items meet their customers' needs. And finally, if you're still with me on the details, the peas, beans, and lentils category, we're proposing to maintain the current total required quantity and number of varieties, but instead of limiting package sizes to 16 ounces like we currently do, we'd like to increase the maximum package size to 32 ounces. Beans, peas, and lentils are common ingredients in many cultural diets, and as such, they're typically bought in larger quantities. So we want to make sure that we're allowing larger package sizes. So since it's easy to get lost in all of the details of what we just flew through, I wanted to end by just refocusing on why we have this ordinance and why these changes are important. I think the city, as a city, we value and strive for equity, and that includes equitable access to healthy foods for all residents. And the Staple Foods Ordinance is one mechanism that we have to help ensure that no matter where someone lives, they're able to find healthy food options close by. And the proposed changes will make it even easier for stores to have the flexibility they need to stock nutritious foods that also align with their consumers' cultural dietary preferences. Thank you for your time and attention, and we'll be happy to stand for any questions.
Great, thank you. I just have to quickly say that Fremont Market is in my ward, so I was very proud to see it in there, and also seeing the excitement, because I know that many of the corner store folks have been in my ward have been very, very concerned about the impact of this. I would say that a question, I don't know if this is necessarily a question for us here, but as we are looking and doing more of this work, I feel like we're slowly chipping away at the convenience store model, like business model, in terms of like access to tobacco, different kinds of tobacco, in terms of, you know, how typically it's like the junk food, right? And so that's what folks go there for. And so I'm intrigued as we are exploring public health policy, how to figure out how to be in relationship with that convenience store model, because I can say every single time I'm at a convenience store, there's probably 4 or 5 kids ahead of me, and every single one of them are getting Skittles and a pop, or, you know, M&Ms and a pop, like, and so I understand that $2.50, where that number comes from, and so I don't know if you have any thoughts on that, but it just in terms of like the convenience store model right now, what it just is almost in direct conflict with public health goals and outcomes. So how do we as a city be in relationship to that, perhaps? Maybe if you have something, that's cool. If not, that's a bigger conversation.
Yeah, thank you, Mr. Chair. The thing that came to mind as you were speaking was that we do try to frame these ordinance requirements as a way that stores can bring in additional customers and additional revenue. If they meet these requirements, they're very close to meeting the WIC standards, which can be an additional source of revenue. So we try to frame it in terms of the benefits that they can experience if they start stocking healthier foods. We also see national trends. The National Association for Convenience Stores actually talks quite a bit about how customers just want healthier foods. And so they're actually trying to shift the industry in the direction of healthier options anyways. And so it doesn't even have to appear like the city is forcing stores to take a trajectory that they wouldn't already take. It's really coming from a national level and corner stores across the country that are just starting to stock healthier options in general. So we try to talk about those things when we're out meeting with the store owners.
I have a question from Councilmember Johnson.
Thank you, Mr. Chair. I just really appreciate all this work and the presentation. I had one, maybe 2 questions for you. And I really appreciate the chair's comments just now about convenience stores and the role they play around health and also being unhealthy. And so when I think of my corner convenience stores, there's lots of signs usually for unhealthy things, advertising that's very visible from the outside. Has there been any thought to, in terms of the proposed recommended changes, trying to incentivize advertising some of the healthy things that are inside the stores? And if not, take it as an idea, maybe?
Mr. Chair, Councilmember Johnson, it's not something that we are proposing as part of the ordinance, but it is something that we talk about with stores when we go out to figure out how we can support them in being successful at meeting the requirements. So we talk about merchandising and marketing, placement of foods within the store, all the different things that they have control over that they can do within the store to make those items more visible, more attractive, more appealing to customers. So signage comes up quite often in that context. I think it's an interesting idea to talk about ways that we can incentivize store owners to make a variety of changes, including more signage. So I would love more conversation on that.
Thank you. And then my one other thought would be any sort of allowance for these satellite farmer markets, or really a farmer stand, to work in collaboration with convenience stores. That might be a possibility over the summer, and I would think that would then require probably some leeway on what they're stocking inside, because if you got a stand outside with a lot of fresh produce, you're probably doesn't make economic sense to stock inside as well. But the possibility to open it up for some partnerships, especially we're seeing more and more urban or near urban agriculture in the area that may want to take advantage of that. And so there might be the possibility for some interesting partnerships there. And the visibility that that brings as well, and just the awareness of eating seasonally and local food access and all of that. So another thought as you're looking at the proposed changes.
Thank you. Yes, I actually think there is an existing partnership like that at a North Minneapolis store, and I don't remember the name, but they've partnered with Brightside Produce, which is a local group, and they set up a farm stand outside of the corner store, and then we've allowed that to count as their fresh produce requirement.
Excellent.
So they're testing that out, and I think that's a great model for other stores that we could help scale up across the city.
That's really great to hear. Thank you again for your work.
Thank you.
That's a win-win for multiple people in that
It is.
situation. And last question here from Councilmember Cordon.
Well, it isn't actually a question. I just wanted to remind committee members that this ordinance has been introduced properly before us. We referred it back to staff. We thought it would be helpful to have a report back now with some of this information so that everybody was brought up to speed. But we don't want to have the public hearing until November. It actually occurred to me, well, maybe we could vote to set the date for November 26th for the public hearing, if that would be all right with you, which is the date that we think will work best for us. I know that the action just says receive and file. We should have thought of this beforehand. We could certainly set the public hearing at some other point, but I'm interested in also setting it early, so when we go out and talk to industry representatives and store owners, and there's some people who are very curious about giving feedback because they had some issues with this. And we are meeting on the 26th, so I'm happy to make the motion to receive and file and set the public hearing for November 26th.
Yes, please.
All right, so moved.
All right, so we have a motion on the table for to receive and file this presentation, as well as set a public hearing for the regularly scheduled peace meeting on Monday, November 26th. Are there any questions or comments from my colleagues?
Mr. Chair,
Yes.
normally we don't set a public hearing on an ordinance unless we have the language. That's a policy in the clerk's office. Is there language ready?
Is there language? I thought you said that there.
Well, the language, yes, we have draft language. We're going to be vetting it with the community, and there may be other amendments. So you want the language to be published?
Yeah, we usually have the language published at the time we set the public hearing.
All right, well, let me pull that motion back, make sure that we have the language ready to be published.
Great. We also have other opportunities to be able to
Plenty
make
of
that
time.
happen. Yep. Okay. Well, so then I will amend that motion to strike the adding of the public hearing. So all those in favor of receiving and filing this presentation, please signify by saying aye. Aye. Those opposed say no. The ayes have it. Thank you so much for all of your work on this. A big body of work, really comprehensive in studying it and being rigorous with it. So thank you very much for all that you are doing. And then last but certainly not least, our final presentation today is going to be on the Youth Coordinating Board. We have Andrew Groot, the Executive Director of the Youth Coordinating Board, who is here to give us a presentation. I just wanted to say quickly before Ann kicks it off that this was particularly important for me to make sure we had this presentation here. Youth development does go through this committee, although the YCB doesn't technically. And so what we wanted to do was to make sure that there was space for all of the colleagues to be able to understand what the YCB does, as well as what the work is going to be looking for. So, Mr. Groot, the floor is all yours.
Mr. Chair and members of the committee, thanks for the invitation today to talk about the Youth Coordinating Board. And I'd like to start out a little bit talking about our origins, because I think it's really important to remember. We were started 35 years ago because the school superintendent, in planning for the school year and in doing a comprehensive plan for the school district, was talking to people in the community, including a number of social service providers. And they said to him, the needs of our children are changing pretty dramatically. And we feel like we don't have a good coordination here. We don't understand what kids need and who's doing what, and we need more of that. So he went to see Mayor Don Frazier. And by the way, I've had the chance to talk to Mayor Frazier about this a number of times. He's just great to chat with about the Youth Coordinating Board. But he went to Mayor Don Frazier and he said to him, we need to do something about this. And so Mayor Frazier's staff took this seriously. They did a lot of research, they did a lot of analysis, they did a lot of communications, and what they found was that we needed really to have a body of people who could talk about our youth across our public jurisdictions. And that body should be made of elected officials as opposed to community members, but people who actually from those public jurisdictions could come and make decisions there at the table. That is part of the power of the Youth Coordinating Board. And two members of your committee, I'm happy to say, Councilmember Cunningham and Councilmember Gordon, are both on the Youth Coordinating Board right now. So you know a bit about this organization, and I appreciate the work that you bring to it. So the Youth Coordinating Board began as a group of elected representatives to spend some time talking about our children and young people to find solutions that would work for those kids. And over the years, we've been engaged in any number of projects in the Twin Cities, and we've started many things from our table. We do not always do everything forever. We often send things out. So Step Up started at our table. The Fathers Project, Way to Grow, the Minneapolis Youth Congress, which is something that we keep in our world and in our work. But we've started over 200 different projects or programs, many of which have gone on to community organizations and other public entities to work on and to complete. We're very proud of those things, and we're very proud to have been a part of that in the city. Let me tell you a little bit about our kids, because I think it's important to know what we're talking about here, how many, and a little bit about them. According to the 2010 census, about 24% of our kids, or just over 91,000 of our residents, just over 91,000, are age 20 and under. About 62% of our children and young people are of color. That's a stark difference for the adult population, in which about 60% are white and about 30% are people of color. 3 in 10 of our children and young people live in households with an income below the poverty line. Minneapolis Public Schools reports that 64% of their students receive free or reduced priced lunch meals. They also report that about 10% of their students are homeless or highly mobile, and about 24% of the young people are English language learners. This is a big group of kids. You know, it's not a little group of kids. Not every single one of those children has problems or difficulties. Many of those children do very well, but a number of our children do face difficulties and problems in the systems that we live in which additional intervention or work is needed. We really believe at the Youth Coordinating Board that our children and young people are a community resource. Part of our goal is to try to shift some of the public perception of our children to help realize that our children are assets to us now, not sometime later. They are assets later. We believe they'll be better assets later if we see them as assets now. So we really value our children. We value what they say. We value what they believe. We value their participation. And we think they need to be a visible and uplifted part of our community. So in response to that, in part, in 2007, the Youth Coordinating Board started the Minneapolis Youth Congress. The Minneapolis Youth Congress is a group of about 50 young people, grades 8 through 12, who we train, we feed, we transport, and we pay to be in the Youth Congress, to bring their voice and experience to the work of the YCB and also into our 4 public jurisdictions and sometimes beyond. Those young people have done some remarkable things in the last 11 years. They tested the Go-To-Pass program that Minneapolis public schools now use. And that's one of the places that we worked beyond Minneapolis because we worked with the Met Council. We worked with Metro Transit on that. Metro Transit still calls our young people and says we say things like we need to know what young people think about X, Y, or Z. And in fact, this year, some of our young people were involved in an ad campaign for Metro Transit. So that's one of the things they've done. They've been involved very much with the Minneapolis Health Department on Rethink Your Drink and the tobacco initiatives. And in fact, some of you heard them testify about tobacco. They're very well spoken, they're very well researched, and they have a very strong opinion. And you had the good sense to listen to them. So I appreciate what you did with them. But they've been involved in a variety of things that we're very proud of over the years. And we're looking forward to our new group of them coming in right about now. And I want to invite all of you to the oath of office on Thursday, November 8th. It's just downstairs in the atrium. Judge Piper will come and swear them in. And it's an amazing thing to watch our young people and their pride of being in City Hall and knowing that they're going to have a role and that they belong here. One of the things our young people...
If I can actually jump in real quick, I just want to make a big pitch for my colleagues to actually really go to the swearing in. It's so heartwarming and endearing to see young folks raising their right hands and doing an oath of office and really having a similar experience that we really had when we got sworn in. And so seeing, just like you said, the pride, like that was really what got me when I saw the swearing in ceremony that I went to. Was just the kids were so proud to be there and so proud to have the experience. So I know it would mean a lot to the young folks to be able to have council members there. So highly would recommend my colleagues to be able to make it if we can.
I will forward an email invitation so you have it in your email. I think that might be a helpful thing. One of the things our Youth Congress said a number of years ago was that young people sometimes need help in traumatic situations, not a surprise. But they came up with an idea for a psychological first aid app, which we call MyCPAS. It's MYC EPAS, but it's about peace. This is the logo. That app started as a web-based program that kids could access on their smartphones, but this year with the help of Recast, we were able to convert it to an app. It's being beta tested Thursday by the Youth Congress so that we can launch it in a big way. It's free, and kids all over the world, all over the country can have access to it. It's a great piece. I'm very proud of it. It includes things like a breathing ball and yoga and a place where they can put their favorite music in, and then a list of adults or friends they can call if they think they're in trouble and they need help. So it's a great resource that our young people have developed for us, and I'm very proud of that as well. We also, I think some of you know, in the city funds, some of our outreach work, our street outreach work. We do outreach work in 3 parts of the city. We do downtown in the summertime, which the city funds, and we also do outreach work on the north side through funds that the health department has received through a CDC grant, and then we do outreach work in Henry High School. This outreach work is a way to have trained adults who are able to engage with our young people, to talk with them, and to help them out in situations that they find themselves in where they really need some assistance. This comes out of some work we did a number of years ago on the Youth Are Here bus, which was really expensive. And so we've converted it now to a street outreach program. Many of our young people have said to us, by the way, no adult ever talked to me downtown before. And so they're happy to have the engagement with adults. We are now looking at, as your chair knows, finding a way to create a youth center downtown, because having a place for young people in a city full of all kinds of things for adults would be lovely. So we're talking about that, working with that, but that's a bit of an outgrowth of the outreach team. We are in the process right now of developing a report and a guidebook about how we do outreach, what our specific model is, that will be able to be used by other places, including our own other public jurisdictions, but also by other cities. The CDC is very interested in using it around the country, so that's happening. So we also are engaged in a little early childhood work that I want to tell you a little bit about. One is that we recognize that about 70% of our children under age 5 attend child care in what we call family, friend, and neighbor care. Could be grandma, could be the neighbor, could be somebody who actually has a child care program in their home, but this is a tremendous amount of our young people. The people who engage in providing that care don't really call themselves family, friend, and neighbor care. They call themselves grandma and neighbor lady and big sister, etc. But what we recognize is that many of those young people, many of those providers don't have access to the same resources that our large child care centers have. So we are creating a program for family, friend, and neighbor providers, and through our research, we found out they want social media contact. They don't want to go to meetings. They want to flip on Facebook or somewhere else to find out resources for them. So we're working on that. We received a grant from the National League of Cities this year to develop this project, and through that connection, we have been given a 2-year fellowship from the Pritzker Family Foundation to do this program into the year 2021. So you will see a lot more out of that, and their interest is in creating 1 million children ready for kindergarten by the year 2023, I think. So you'll see more and more about that, but we're very proud of that program. The other thing to talk a little bit about regarding early childhood is that we are in this process of creating children's savings accounts. So this would be a seed account for every child born in the city of Minneapolis to be used for post-secondary education, whatever post-secondary education that they choose. This strategy is a promising new strategy that is being tested throughout the country. There are enough places now that we actually have data on how well it works. But it is a strategy that we are working on at the Youth Coordinating Board. The city has funded us the last 2 years. And as I said last week in the Budget Committee, the mayor has not put any money into the budget for next year. But we are interested in continuing to do that work, and we'll have a report on that very soon. Finally, just to tell you the kind of last big area that we work in is after school. So we work to coordinate a citywide system and network of after-school providers so that we can help them develop ways to have continuous quality improvement, to continue to use data well, but to really make sure that our young people have after-school programs that really help them in school, that help them develop the kind of 21st century skills that our employers are telling them that they need, like team building, communication, conflict management. After-school programs also help working parents. I know they help me. And they also help keep our kids safe. And so we're working hard in that area to develop this infrastructure. At the same time, as many of you know from the other day, after-school funding plummeted. In 2010, we had about $37 million. This year there's about a little less than $10 million. And if the federal government's budget is passed without 21st Century Community Learning Center money, that money will be cut at least in half or more in the city, which leaves those children of ours who do not have the resources to pay for ballet and clarinet and soccer and other after-school activities. That leaves them with very little resource. And in fact, there was a huge drop last year in funding, and it was the police who noticed it. And they told our outreach team that they were noticing more kids on the street with nothing to do and were wondering what was going on. So our very own police department are the people who noticed it right away because they saw the children out there. And we're very concerned about what that would mean for their safety and for what happened in the community. So those are the big areas that we work on at the Youth Coordinating Board. We, Mayor Don Frazier, when he gave his State of the City address in 1987, he talked about us creating a revolution in our neighborhoods and in our city, in which all of our children are valued, and in which all of our children have what they need to grow up and to do well and to be successful. We are about what Mayor Frazier wanted us to be about. This is the work that we do. We really want to make sure that all of our kids have the same opportunities. And I look forward to continuing the work with the city and the county and the parks and the schools. And I appreciate your time today. And I'm happy to take questions or have conversation about this.
Great, thank you so much. Do any of my colleagues have any questions? Councilmember Cano.
Thank you, Chair Cunningham. So first of all, I really appreciate getting to know more about the work that you've done, and it was really good to be able to connect with you personally when we had the meeting on the municipal ID ordinance, and that is also coming up on November 26th, actually, when you were talking about a public hearing. So we'd love to see you and some of the Youth Congress members there to publicly testify on the effort. So that'll be at the November 26th Peace meeting. And as you were talking about all the different fronts that the youth are engaged and actively participating in, it just I just wondered about the comp plan conversations that we're having now, and just wanted to see if there had been discussions with the youth or by the youth around, the city's process that we've taken up over the last, I think it's been maybe now 3 years. At least preparation for it has been at least that much. And so we're getting ready to adopt the comp plan. The final adoption will be December 7th. And just wondering if the youth have been able to maybe engage with that topic, or is that something that's totally removed? Or I'm just curious about what those conversations might be like, because I know for us, we've been discussing it a lot lately, and we're getting ready for a big public hearing on it as well. So that might be another opportunity for the young people to come over and share their thoughts and their ideas about how the city of Minneapolis is going to grow for the next 20 years or so.
Council member, Mr. Chairperson, that is a great question, and I'm glad you asked it, because it reminds me of a couple of things that I want to make sure to let you know about. First of all, I always tell our young people, when you're 40 is when this comp plan is going to be in effect. So, they were born at the turn of the century. Most of our young people are a little after. So the comp plan is very relevant in their life. So when the comp plan first kicked off, the Youth Congress was interviewed. They did a focus group with the Youth Congress, and several months later they came back to report to the young people about what they learned and get some more input from them. So they have had a significant impact in the comp plan. I was also involved in the comp plan in talking about how youth can be more integrated into the plan, and I think there are some ways in which that's happened that it hasn't happened before. The third thing is that one of the things we're doing this year, this is a big part of our work this year, is to develop a citywide children and youth master plan. The last one we did in Minneapolis was in 1987. So we're doing another one because we thought maybe it'd be good to do an update. So we're doing this youth master plan, We've started in August. We hope to have a report to our board next August. And part of that plan is going to involve 13 ward meetings this early spring, so March, April, in which the Youth Congress will facilitate an information session with young people from the ward, and we will be inviting all of you and making sure that you can come. We really want you to come and hear what young people have to say. We'll also invite other elected officials as well. So we've had some engagement in the comp plan with the Youth Congress. The Youth Coordinating Board has been at the table, and now we've decided to take on a youth master plan. We've been in contact with the city coordinator's office about the youth master plan to have some, make sure that they know what we're doing, but also make sure we can have their assistance, and they're very excited about it. And they're thinking about how do we integrate this into the comp plan more. So those are the things going on around planning. Thank you.
Council Vice President Jenkins.
Thank you, Chair Cunningham, and thank you, Mr. Groot. I'm wondering, I was around when Youth Congress first started, and so really thrilled to see that work continuing. I'm curious, is the Congress a part of a broader national youth Congress, and how does that work?
Council Vice President, Committee Chairman. That's a great question. There is not really a network of youth congresses, youth advisory groups, or anything like that. The Youth Coordinating Board is part of an organization called the Forum for Youth Investment, who every summer has a meeting of cabinets. And most of those cabinets are statewide cabinets, and they meet and talk about what do those kinds of statewide groups do. They've started a little breakout group because the statewide cabinets didn't get at what cities and counties were doing, and I attend that group. There's only about 14 or 15 of us in the country. Most of those types of cabinets are statewide. At the last one, I was asked to talk both about our history as a Joint Powers Board and secondly, to talk about the Youth Congress. And what I've learned in all of these meetings that I've gone to is that we're the largest one. We're one of the only ones who pay and train their young people. And most of the other organizations are trying to figure out how in the world do we catch up to that. We really want to do that. It's really important. And I've talked a lot about how if you really want young people to participate, you can't just sort of invite them to come and not give them any background. You have to pay them. You have to feed them, make sure they can get there safely and back. So there's lots of conversation around the country about it right now, but I'm proud to say we're the biggest, most established, and most well-funded youth advisory type group in the country. There is one at the federal level, too, that is really, it's an interagency working group on children and youth, and they're right now trying to figure out how to have a actual children and youth group to work with them. So we are leaders in this, and I can't tell you how much people wish that they could do what we do. I also want you to know a lot of that work is funded by the city of Minneapolis, so you should be very proud of them.
Thank you so much. But I guess follow-up would be a little somewhat related, but you said City of Minneapolis is primary funder. What's the support like from other jurisdictions, including Hennepin County?
Council member and committee chair, all of the other jurisdictions pay joint powers fees, which goes into the Youth Congress. Mm-hmm. And so everybody pays a piece of it. The city is part of that. So.
Okay. All right. Thank you.
Before we close out, I just wanted to go back to a point that was made fairly briefly about the work that is happening through the Youth Coordinating Board, and that is after-school quality programming. So research has found that a young person going to an after-school program that is low quality, so the the youth worker that's leading it is not well versed in best practices, that's actually worse than not going to a program at all. A lot of times folks end up in youth work. Like I became a youth worker with no training, just having been somebody who was good with kids and had experience with dance and other things that I could teach kids. But I had to learn along the way actually how it worked. By having this space where we are actually talking about quality improvement in after-school programming, that is actually quite forward thinking in terms of providing training and support for youth workers that are outside of the classroom but are just as valuable as classroom teachers but just don't have as much support. Can you just briefly speak a little bit more to what the work is that around the quality piece of after-school programming?
Yes, Committee Chairman. Yes, I can, and I'm very pleased because we've developed quite a bit of this in Minnesota the last several years. We have a statewide group called Ignite Minnesota, and they have developed a number of training packages that we use. One is called M3, Making Meaning of Multiple Data Sets, and it's a way to help youth workers understand all the data they have and how you use it, how you don't just collect it, but how you use it. We also have a program called Believe It, Build It, which is how to build an after-school program and to really make the after-school program work. We also use a national model called the YPQA, which is the Youth Program Quality Assessment, and it's a way to evaluate the work real-time, in a real-time way. We've trained youth workers how to use that, and we've also trained young people how to be evaluators. So that's been a very good, I think, combination of things that happen. Additionally, we do an annual conference along with Minneapolis Employment and Training and the Health Department called the Partners Conference. It's going to be February 15th this year. And that is a training in which we bring youth workers together to do some of these more formal trainings, but also to do some more conversation about what it is that they need, what they want, what are things that they want to know about. For example, I've done trainings on how to lobby, for example. So we've done different things with that group. And we also bring together youth work professionals 2 or 3 additional times a year for topic-specific things. It's a community of people who want to learn and who want to do a great job. Some of our larger institutions have been able to provide a lot of those trainings, but our smaller nonprofits don't have the money to do it. So the more we can provide that for them and use our partners to do the training, the more well-trained people are in being able to really assess and improve quality on a regular basis.
Thank you so much. There are so many, as somebody who's worked with young folks predominantly outside of the classroom, although I have worked in the classroom too, I can just say that there are mounds and mounds and mounds of research that show that out-of-school time programming is so hugely important to the development of young people. So I really thank you for all of your leadership in that area. Do any of my colleagues have any further questions or comments? All right, not seeing any further questions. Thank you so much for your time today.
Thank you.
For joining us. And I would like to move to receive and file the presentation on the Youth Coordinating Board. All those in favor of the motion, please signify by saying aye. Aye. Those opposed say no. The ayes have it. On that note, seeing no further business before this committee, we are adjourned.